good afternoon or good evening, everybody. This is Paul Melmeyer. I'm the Executive Vice President of Public Policy and Advocacy at the Muscular Dystrophy Association, and I will be your host for the evening. So this evening, we're going to be talking about protecting Medicaid and the latest updates. And if you've been following the news and if you've been following our advocacy alerts on social media, in your email inbox, or otherwise, you know that there are some substantial reforms to Medicaid being considered right now, and we wanted to bring the very latest to you and tell you how you can get more involved. So with that, let's move to the next slide. This is our agenda for the evening. We're just going to introduce ourselves a little bit further. You'll be getting to know those who are going to be speaking tonight if you don't already know them. From there, we're going to touch on just a little bit of a reintroduction to Medicaid, just in case perhaps you're joining us for the first time, or at the same time, Medicaid's a complex program. I think we could all use a little bit of a reintroduction. We'll talk about what Congress is considering right now and how what they are considering very much threatens Medicaid. And then we'll, from there, talk about how you can get involved. After our presentation, it's going to be a little bit of a shorter presentation for this evening because we're going to try to leave a good amount of time for discussion, both a discussion within the panelists here, who you'll meet here in a moment, as well as any questions that you may have for us about what Congress is considering right now. So speaking of questions, let's move to the next slide because this is the housekeeping slide, if you will. So a couple of things to point out. So on the left side, the bottom left side of your screen, right down there, there is a closed captioning little button. So click on that for closed captioning. And then for questions and answers, we're going to ask you to go to the three little dots on the bottom right of your screen. And there you can click on those three little dots, hit the Q&A, and submit your question there. Now the chat is also open to be chatting with each other if you'd like, but really the best way to be submitting questions so we can see them, so we don't lose them, is to put them within the Q&A box. Now this is being recorded, so everything we're going to be saying throughout the evening here is going to be recorded, and then hopefully within a week or two we'll be uploading this to MDA's YouTube channel. So if you're scribbling notes trying to get everything down that we're saying on paper, don't worry about it too much because we're going to have that recorded. You can always take a listen to it a little bit later on once we have it posted. So I think that is probably the housekeeping items for the day. So let's meet our panel. I've already introduced myself, but on the right side of your screen, joining us this evening will be Mark Fisher. Mark is our Director of Advocacy Engagement, and Mark will be in just a little bit talking about the ways in which you can get involved to defend Medicaid, to stand up for such an important program. But first, we're actually going to start with Joel Kartner. Joel Kartner is our Director of Access Policy here at the Muscular Dystrophy Association, and Joel's going to give you the latest updates on what's happening on Capitol Hill. He's going to start with the basics on Medicaid, though. So, Joel, I'm going to hand it over to you. Thank you.
Thanks, Paul. So yeah, we're going to start with the basics on Medicaid. I know this is probably going to be review for a lot of you, but just in case we have anybody new in the audience, or in case someone new wanders across the YouTube video eventually, we just want to give just a very quick overview of what Medicaid is. So Medicaid is a federal and state program, meaning that it's a partnership between the two. The federal government provides the majority of funding in that partnership. It covers nearly a fourth of all Americans, which is about 79 million people. Medicaid is for those with lower incomes or those with disabilities as well. And it covers a very wide swath of our community as it stands. Over 40% of the neuromuscular disease community relies on Medicaid in some way, shape, or form. It provides important access to home and community-based care, primary care, specialists, rehab, and things like that. It's also incredibly important in rural areas as Medicaid is used to fund transportation and assistance to and from rural areas to health centers as well. And just as a bit of roundup, there on the right side of your screen, you can see that Medicaid covers 2 in 5 births in the US, 2 in 5 children, 1 in 6 non-elderly adults, 2 in 5 adults with disability, 1 in 4 adults with substance abuse disorder or a mental illness, and 3 in 5 folks in nursing facility facilities as well. So it's a massively important program for both our community and the country. Mark, you can go to the next slide. So, what exactly is on the table in terms of potential Medicaid cuts that Congress is considering? Well, and really, let's take a step back for a second and just go over what's happening. So, currently, Congress is moving through a process called reconciliation, which you can see on the right side of your screen there. And basically, that is an arcane policy vehicle by which Congress can use to try and pass bills of a budgetary nature when there are a single majority in both the House, the Senate, and the presidency. It's an arcane form of budgetary policy, as I mentioned, and it allows these measures to move through with a simple majority in the Senate rather than through the filibuster, which would normally require 60 votes. So, as we all know, President Trump has floated some pretty substantial tax credits, and the way that those tax credits need to be paid for as to become, fairly budget neutral, cuts need to come from somewhere. So the House and the Senate both are taking up various forms of budget to try and get those cuts moving. Of course, those versions do eventually need to agree at some point. In current, the Senate Finance Committee has set a ceiling of $1.5 trillion in cuts, and the House Energy and Commerce Committee has set a floor of $880 billion. As you can see, these two numbers don't agree, and right now they need to at some point. So there's still lots of conversation that needs to happen as we move through. But now that both the House and the Senate have passed some framework through which this budget process can begin, the real work does now begin in that they need to put pen to paper and really game out how exactly they're going to get to these cuts. Now, why does that matter for Medicaid? Given that the House's floor is $880 billion, that floor has been directed in part to the Energy and Commerce Committee. Now, I know Energy and Commerce doesn't say health, and one thing that you've likely seen in the news is that none of these budget proposals contain the word Medicaid. But the thing about directing the Energy and Commerce Committee to make cuts of this nature are that the biggest pot of money that the Energy and Commerce Committee has in its jurisdiction, in its committee's jurisdiction, is the Medicaid program. So we know that if they're going to hit this $880 billion number, those cuts really do substantially need to come from Medicaid. So we are anticipating cuts being on the chopping block here as we move forward. The Energy and Commerce Committee is set to mark up their version of this floor on May 7th, and we will expect to see bill text that bears this out here in the next couple of days. So that's why we're talking to you about why all of this matters now, because we're really coming up against some pretty harmful cuts to Medicaid as we move forward. After May 7th, assuming all things go smoothly, which, frankly, who knows if it does or doesn't, the full House is expected to vote on the week of May 19th. Mark, you can move forward. So what would these cuts potentially look like? What would they mean, etc.? There are a number of options on the table that the House has considered. And they kind of come in a variety of buckets. The first of which is per capita caps. These are capped allotments for Medicaid funding based on the number of people in a state who are on Medicaid rather than their usage of Medicaid. So you could have, for example, a state with a lot of people on Medicaid, but not a lot of usage of Medicaid. And so they would get a larger slice of the pie and more bang for the buck. But if you had, say, a state with, sure, less people on Medicaid, but that their usage rate at the cost of that care was higher, then you would see them kind of bumping up against the amount of money that they were receiving from the federal government in order to pay for those costs. So more money would need to come out of their state's budget, for example. Kind of in a similar vein is cutting the federal matching percentage of Medicaid rates from the federal government to the states. So that is just straight up reducing the percentage by which Medicaid is reimbursed from the federal government to the states. Importantly, there are 9 states that have trigger laws on the books that say if the federal matching percentage falls below a certain percentage point, it varies, from state to state. But if it does fall, then that automatically triggers the state to exit um, Medicaid expansion policy as well, and that'll become important. Well, it's already important just by itself, but it'll become increasingly important here in a second. And that is in cutting provider taxes. This is the only mechanism for states to fund their share of Medicaid costs because it's a tax levied on healthcare providers and hospitals that are operating in the state that bill Medicaid. So having a rate at which that tax is levied lessens really does kind of cut potential resources from the state. So you could see potentially hospital closures as hospitals are receiving less money come down from states. But that's also important because remember those trigger laws that I mentioned. If states then also, uh, as along with kind of having a reduced federal matching rate in terms of percentage, if they also additionally leave the Medicaid expansion group, they're also drawing less money in that way. And so by doing so, those provider taxes and lowering of those provider taxes hit those states even harder as well. So it's kind of a really double-edged sword for those 9 states, as well as the handful of states that are still non-Medicaid expansion as well. And then finally, we've got work requirements. To be clear, work requirements are not about work; they are about administrative burden. Work reporting requirements could lead to eligible beneficiaries being kicked off of Medicaid, not because they, make too much money or otherwise don't qualify, but because there was some kind of programmatic issue with their paperwork. Maybe they filled it out wrong. Maybe English isn't their first language, so they couldn't, move through it effectively enough. Or maybe it's as simple as they just weren't able to meet the deadlines to file their paperwork reporting requirements. I'll probably wind up mentioning this a couple of times tonight, but Arkansas very briefly implemented a state version of work reporting requirements, and we saw a substantial number of people get shuffled off of the program, again, likely due to programmatic reasons, in just 6 months in before that program was stopped by federal courts. Um, all of this to say is that any of these cuts to Medicaid would have huge impacts for both states as well as folks with chronic conditions and disabilities who rely on these programs and services that are provided. One thing that we keep saying over and over again is one of um, the things that people rely on the most is home and community-based care through Medicaid, and that is a voluntary program through Medicaid. So cutting federal matching rates means that home and community-based services, for example, is likely first on the list of services to be cut if federal funding is impacted. Mark?
Thank you, Joel, for providing that overview of what's going on in Congress. For those who don't know, my name is Mark Fisher. I'm the Director of Advocacy Engagement. And I want to talk a little bit about what we have done so far as a community to stop and try to fight against these Medicaid cuts. So before I begin, we really hope that we can get a bunch of questions. I see a few coming in through the chat or Q&A box already. So feel free to please add them into the chat or Q&A box. We have a lot of time left for questions, so we wanted to make sure we're going to answer as many as possible. So if you have a question, feel free to put it in. And if you already have, thank you. We'll get to the end. So as Joel's mentioned, it is this couple weeks are going to be pretty important in our quest to protect Medicaid. One of the main, as he said, a main committee is going to meet next week to talk about what cuts might be made, and Medicaid could be in trouble. So this is a very, very make or break few weeks to protect the Medicaid. However, we have made so much progress so far, and we wanted to highlight what we have all done together. Because we have been fighting tooth and nail. We have been having full court press, whatever analogy you want to make. We have been really fighting really hard to protect the program. So together, we've been really raising our voices. MDA alone has sent over 9,100 messages to members of Congress urging them to protect this program. It's one of the most engaged campaigns we've run, and we've been seeing lots of people raising their voices saying, please protect this program. And even more importantly, 40% of the folks that sent in messages to members of Congress, they shared a personal story with that message, and that's vital. members of Congress get emails all throughout the day, as you can imagine, and having a personal story attached to one of our emails, or editing our sample message and adding your own personal touch really makes it stand out. It really ensures that the member of Congress and their staff thoroughly read that message. So for the folks who have already added a personal touch, thank you. It really does make a difference. And the fact that 40% of the folks who have sent messages did that is quite remarkable. We've had dozens and dozens of people make targeted phone calls to key members of Congress and their offices, urging them to please protect Medicaid from these cuts. Phone calls still work. Folks still answer the phone. They still have to talk to constituents. So it's still a very valuable and a very important way to message members of Congress is to pick up that phone or pick up your phone and call them. And many advocates have been doing that. Our Joel and Paul and team have been having meetings constantly on the Hill with key members urging them to protect the program, but so have many members of our advocate community. They've had virtual meetings. Some folks have had in-person meetings. Some folks have had meetings in their districts, really urging members of Congress to protect this program. So we've been seeing many meetings. But even more impressive, we have collected so many powerful stories from many of you urging members of Congress to protect this program. We have worked with many of you to turn your stories into op-eds, letters to the editor. We have made videos that we posted on social media and shared with members of Congress. We have shared your stories directly with your members of Congress as well to show why it's so important to protect the program. And that's really key. I can say every statistic known to man to go on Capitol Hill, and they're very powerful, but really that story of how folks like the folks on this call rely on the program really hit home. So we've collected many powerful stories, and we have shared them in many ways to really encourage members of Congress to protect the program. And we'll continue to do that. In addition, I want folks on the call to know that we're not working alone in MDA. We work with countless other organizations who all care about Medicaid as well. We belong to many coalitions, including two on your screen there, the Partnership to Protect Coverage, the Consortium for Constituents with Disabilities. Those are two that we work with. They're made up with countless organizations that many of you probably know. All of us are working together to protect the program. So we have sent in many messages. Advocates from other organizations have sent in messages. We've had many meetings. Advocates have had many meetings from other organizations. We're all working together to protect this program. So we've really had a really powerful first couple months in this quest. And you can see some of the things on the screen that we've done. We've done massive work on social media, videos, first-person videos to protect Medicaid. So we've had a really great start. And we have seen it work. We have seen our message get across. Just today, I did a Google News search about Medicaid and the budget, and these are just some of the first things that were posted today. We have seen news articles all over the country sharing what some of the things that Joel talked about, how it might impact the Medicaid program. So we have seen newspaper coverage and media coverage from places from Alaska to Virginia to Ohio to Louisiana. I think I got almost all corners of the country and anywhere in between in local papers and local news markets sharing what Congress is doing and how it can affect people who rely on Medicaid. Now, some of these headlines might be a little nerve-wracking, and they are, but it shows that our message is getting across, and it shows that our message that what Congress is doing will affect the Medicaid program is being heard loud and clear. If I did that search this morning, I didn't get anything. I got nothing on Medicaid. I'd be really, really worried because what Joel said is happening is happening. So it's good that our message is getting across, and it's good that people are paying attention and they're realizing that what Congress is doing, it can affect the Medicaid program. But we're not going to stop at headlines like this. These are all fine and well, but I want the next headline to say Medicaid program saved from cuts, or advocates work together to save the Medicaid program. That's the program. That's the headline we ultimately want to see. And how do we get there? Is we keep up the momentum that we have going right now. So what can folks do between now and whenever this process plays out? As Joel mentioned, we have a few really key meetings coming up in the next couple of weeks. We have a key markup coming in the Energy and Commerce Committee that really could decide what happens to the Medicaid program. So we have time to stop these cuts. So what can we do to keep the momentum going? First, if you're new to us, welcome. We're so happy you're here. If you're new to us and not part of our advocacy program, please join us at mda.org/advocacy. We would love to have you and join us. Again, as I mentioned before, if you haven't shared your story with us about why Medicaid is important to you, your stories are more powerful than ever. We just got requests literally today from members of Congress asking us to share stories with them about why Medicaid is important. We get those requests all the time, and they truly make a difference. So if you haven't shared your story with us, you can do that at mda.org/Medicaid. You can email us at advocacy@mdausa.org. Just get in contact with us. We'd love to hear why Medicaid is important to you, because those stories are more powerful than they ever been before. We've taken some of those stories and we've turned them into letters. The other op-eds, we've made them into videos. Those stories are just so powerful. So please share the story if you'd want. We'd love to have it. And third is don't let up the momentum. Don't let off the gas. Please continue to contact your member. Again, decisions are being made as we speak about what possible cuts could be coming to Medicaid, and your voice is more important than ever. So if you message your members of Congress, it's a great time to do it again. If you called your member of Congress, it's a phenomenal time to call them one more time and urge them to protect the program. If you've already done it, it's a perfect time to do it again if you messaged them already. It doesn't matter what side of the aisle your member of Congress is currently. All members of Congress need to hear from you. They need to hear from you. Even if you think they might be protective of Medicaid, please message them. If you're not sure, message them. It's a perfect time. It's a crucial time, so make sure your voice is heard. And let's add to the letters that we've already sent, and let's continue the momentum. So in saying that, you can always go to mda.org/Medicaid. That's everything you need there to take action. So after that, there's more we can always do. There's a lot more we can do. We expect this process to take still a few more weeks, so we know members of Congress will be back in their districts soon. If you haven't, been able to, we encourage you to go to a town hall or a teletown hall of your member of Congress. If you're not sure when those are, we encourage you to sign up for your member of Congress's email list or social media platforms. That will let you know when they're in your community. And you can participate in that. We have seen many advocates attend them over the last couple weeks, and we know they're effective. Please follow us on our MDA social media and share the posts that we do as well. We routinely post on all the platforms urging other folks to protect the program. Feel free to share our content. We love to continue to amplify those posts and all of our voices together. As I said with that slide with all the headlines, every member of Congress is basically being asked what's their stance on Medicaid. We've done such a good job at highlighting the issue that members of Congress are being forced to answer these questions. Look up what your member of Congress said. I would be pretty confident they've been asked this question. So see what their stances are on Medicaid. And keep an eye on them in the news to figure out how their stances have changed. Hopefully they have come and to our side to protect Medicaid, but keep an eye on that. And finally, we'll have plenty of more programs like this for you to join. We'll continue webinars like this one. We have our new program called MDA Advocacy Office Hours, where you can come and ask us any question you want. Our next one is tomorrow. Hopefully many of you have gotten an invite to that. If not, feel free to reach out. We'll send it to you. But keep in touch with us. We have plenty of online programming. Again, mda.org/Medicaid is the best way. We produce a few resources for you as well. These are very new that we've done in the last couple weeks. So first, we published a blog over the weekend about 5 things to know about our effort to protect Medicaid. Medicaid can be a very complicated program. We all know that. So we boil it down to the top 5 things that we think folks should know and 5 things to know about our Medicaid program. So this is the perfect thing if you're just getting started and want to know what we're protecting, or maybe you want to send it to a loved one who's not quite sure and we just need to break it down to 5 things. We encourage you to read this blog because it really can help digest this issue into very easy to grasp just 5 things. For folks who want to dive a little bit more into the weeds, love those people too. We have a lovely 1-pager that goes into more depth about what we're doing to protect Medicaid. It is a PDF, but some people love the wonkiness. I do. It goes into way more depth of what we're doing to protect the program into just more detail. For folks who are audio learners and love a good podcast, Joel Cartner, who just was on, and other colleague Jory Hauk were just on our Quest Media podcast about protecting Medicaid as well. So if you're a more audio listener or have just want to listen to more podcasts, we have a podcast too that can help talk about what we're doing to protect the program. So there's 3 easy ways, 3 resources to share that we have just come up to protect the program. But all in all, the best thing to go is to mda.org/Medicaid, has everything you need to help us protect this program. So that's an update from the grassroots side. We have made so much progress. Our advocates' voices, I promise you, are being heard, but we can't let up now. We're really at a crucial point. So thank you for joining us, and I'll turn it to Paul, who will facilitate some of the questions that we got. So Paul, off to you.
Thank you, Mark, and thank you, Joel. And if you want to check out those 3 resources that Mark cited, they are in the chat. I just copy and pasted links there, so feel free to click on them there, explore our blog, explore our fact sheet, take a listen to the podcast to hear more from our team here. So thank you to everybody who's been putting questions into the Q&A, a question or so in the chat as well. Keep them coming. We'll get to those here in just a moment, but I wanted to just start with a little bit of a discussion between Mark, Joel, and myself on some of the questions that perhaps we didn't have a chance to get to within the presentation, or some opportunities perhaps to put some kind of finer points on a few things. So Joel, I wanted to start with you because something that we're hearing from some in Congress and some outside of Congress who are calling for reforms to Medicaid is that the reforms that they're pursuing will not affect, quote, who the program was originally intended for. And what they mean by this is the sick, the disabled, children, pregnant women, etc. So if those who are pushing for these Medicaid cuts are saying this, why are we not comforted by that? Why is that not an assurance to MDA? Why shouldn't that be an assurance to the neuromuscular disease community?
Yeah, I mean, at bottom, the Medicaid is such an intertwined, integral program with communities that there really is no way to carve out specific populations of folks from cuts to the program. So if you say cut provider taxes and that causes a hospital to close, that's going to impact anybody in a given community, right? But more importantly, and kind of drilling down on a more micro level for folks with disabilities, taking the issue of work requirements again as an example, you can say, oh, well, we'll have a waiver for folks with disabilities so that all you have to do is prove your disability, and then you are kind of carved out from the program. One, that still means that you have to go through the paperwork process of proving that disability and navigating the government, in that way. And then 2, as we've seen, governments make mistakes, and things happen. So just by kind of opening this Pandora's box of trying to carve people out, we will inevitably end up harming people that we don't mean to by instituting programs like this.
Yeah, the Medicaid program is a bit like a balloon. You squeeze it on one end, it's still going to stretch on the other. As Joel said, there's really no way of just simply lopping off part of the Medicaid program without the rest of it being affected. So this is why we don't really hold any assurance when those in Congress or those outside Congress say, oh, we're going to cut from only those who don't really need the program. Everyone else is still going to have it. That's never been successful. It won't be successful this time. Hence why we are as concerned and as oppositional to what Congress is considering doing with Medicaid in this session. Mark, I'm going to turn to you next. And you already mentioned this a little bit, but I'm hoping you can just reemphasize a little bit, because I think that there are probably folks on the call tonight who are represented by senators or a congressperson who maybe agrees with literally everything we said tonight. So why is it still worth reaching out to them? Why is it still worth taking a moment to reach out to them, even if they might be perfectly aligned with everything we're saying?
Yeah, absolutely. It's a good question. I hear this all the time. And it's, first of all, it's always important to contact your member of Congress, even if you think they agree with you. They want to hear from you. They want to hear what you care about. They want to represent you. So even if you think they are on your side, it's so important to reach out to them and confirm that and tell them why they need to fight. They're gonna have some hard votes coming up, no matter what side of the aisle you are on. There are gonna be some hard votes coming up, especially around Medicaid, and they need to know that what their constituents think for them to in order them to make that difficult and hard vote coming up. In addition, even if we have a member of Congress who wants to protect Medicaid, your story is just as valuable to them, and your voice is just as valuable. They use stories from constituents to craft floor speeches. They use stories to craft press conferences and press releases. They ask groups like ours all the time if we have stories in their district of folks who are on Medicaid, who needed for their independence, and so they use stories from the district to help bolster their points and help them protect the program. They also talk to their colleagues across the aisle. They do, I promise you. And so it's very simple for them to say, hey, I have so many folks in my district who have been contacting me to protect the Medicaid program. I'm absolutely going to vote for them. I'm pretty sure you have similar people in your district, Representative Smith, who also be impacted. Let's talk about how we can make sure that all of our constituents are protected. So they can advocate for you across the aisle, even if they agree with you. So it's so important for you to contact your member of Congress, no matter what you think their opinion is of the Medicaid, because we're at a critical time. They need to hear from all of us. So it's a great question. Keep the contacts coming, keep the stories coming, no matter what side of the aisle your representative or senator is on. It's important for them to hear it.
Yeah, very well said, Mark. I'll say that I used to work within a senator's office, and we used to track all the issues that people were calling and writing in about, and it was over 100 at least a day, maybe hundreds a day. And so a Senate or House office has to decide of all of those issues, what are they going to prioritize their time and attention? And that's why even if they agree with everything we're saying, if they're not hearing from us, they might not prioritize it as much. They might prioritize another issue that might be a laudable issue for them to work on. But unless they hear from their constituents, they may just go work on something else. And that's why, even if we believe they 100% agree with us on this issue in particular, it's still important to be re-emphasizing how important this is to our community for all those reasons that Mark just cited. Just one or two more questions from me, and then again, thank you everybody for the excellent questions we're getting in the Q&A in the chat. Keep them coming. We have 27 more minutes in our hour, so we have got plenty of time. We're going to answer those questions in just a minute. But before we get there, Joel, I'm going to turn to you with a question about kind of the interplay between states and how the federal government, in this case Congress, is contemplating changes to the Medicaid program. So how would a state let's say an advocate is online with us right now and they live in Maine, and another advocate lives in Montana, another advocate lives in Minnesota. How might, if these changes came to pass, how might these three advocates, these three individuals with the neuromuscular disease, or their family members for that matter, how might they experience the effects or the consequences of these cuts in different ways?
Yeah, so Paul, you teed me up to say one of my favorite jokes, which is if you know one state's Medicaid program, you know one state's Medicaid program. So in reality, those three constituents, their impact to the program being cut would be vastly, vastly different because those states prioritize different things. So for example, one state might have a waiver for home and community-based care, another may not, or that waiver might look differently. Similarly, states finance their Medicaid programs different ways, and that money goes to different programs and services as well. So it will be a very state by state process determining exactly what practical impacts happen if we are in fact unsuccessful in mitigating these cuts. However, just because we're talking about the potential reality of Medicaid cuts coming to pass does not mean that we are not going to work as hard as we possibly can to make sure that the program remains safe. And if the program does in fact become cut, we will be working both within MDA across our various programs, but also with Congress to make sure that those impacts are as mitigated as possible as well.
Yeah, thank you, Joel. We'll certainly be prepared if the unfortunate does come true, which is Congress actually enacting these cuts to the Medicaid program, that we will still be fighting tooth and nail to preserve as much of the Medicaid program and access to all of the care and services that our community deserves. With every opportunity that we can, we'll be taking to still preserve as much of the Medicaid program for our community as possible. Hopefully it doesn't come to that. That's what we're working on tonight, of course, but that is what we will do in that case. Just one more question, and then I'm going to turn it to the Q&A box because we're getting so many good questions there. So just one more for me. I'm hogging the mic. Mark, you already mentioned a little bit about the ways in which folks can take action, and I just want to at least leave my last question to you on this because, again, I want this to be reemphasized because I imagine we have a lot of active folks on the webinar with us tonight, folks who have already emailed perhaps, folks who have already called. what more can or should they be doing? You already mentioned all the kind of suite of options, but I just want you to say it again, if you will, of just
Sure.
the ways in which our most active advocates can still be our most active advocates going forward.
Absolutely. First, if you have emailed or you have called or you met your member of Congress in the last couple months, thank you. First of all, thank you for doing that. We're so appreciative of you raising your voice, truly. So thank you. But we're in the legislative process. There's always little checkpoints, or there's always little areas where our voice can be heard again, and you can raise your voice again. We're at one of those points. So, um, as Joel said, there was a joint budget resolution that was passed. Now, both the House and the Senate need to put pen to paper and talk exactly how they want to make budget cuts and how they want to do. This is now a checkpoint. This is now a new chapter in this book. I know I'm so many analogies today. This is a new step in the process, and every time there's a new step in the process, it's a perfect time to raise your voice, even if you did it already, because members of Congress are expecting it, and it's a good time for you to reiterate to folks, hey, we're at this new point of the process. You're now figuring out what the budget cuts want to be. I want to remind you again, please protect Medicaid. It is so important to me because of X, Y, and Z. And the next, I'm not sure what's next, but the next one, the next chapter, the next checkpoint, the next step, it's a great time to do it again when there might be a vote. So all along this process, there's so many different times to raise your voice, even if you've done it before. So if you're still active with us, please remain active with us. Please continue to message your members of Congress, because it's something that Paul said earlier. We don't want members of Congress to forget that we care about this. So if they don't hear from us again during this time, they might say, I haven't heard a thing lately. So I guess it's, maybe I'll focus on something else. They can't focus on something else. It's got to be this. So if you've messaged before, thank you. It's a great time to do it again. And we appreciate you doing it.
Yeah, absolutely. Thank you, Mark. And Mark, you mentioned earlier that decisions are being made as we speak. That's actually quite literally true. Tonight, the Energy and Commerce Committee is actually meeting to talk about what cuts they want to consider within the Medicaid program, literally as we speak. So the time is right to be having this conversation. The time is right for you all to be taking action for sure. All right, so we have a good amount of time to get to the questions. We have some in the chat and definitely in the Q&A box. And I really, again, appreciate everybody for posting questions in both places for us to continue along with the conversation. So we're going to start with a process question from Keith, and this is in the Q&A box. And Joel, I'm going to pose this to you. And this is about the budget resolution that was approved by both chambers. Was this the Senate version? Was this the House version? What were the differences? How are the two chambers of Congress actually perhaps approaching this differently? So maybe answer Keith's question directly, but then maybe tell us a little bit about how the House and Senate might be approaching this a little differently.
Yes, so the final versions that were passed through were ultimately the Senate versions. However, importantly, the Senate kind of gave itself a little bit of a escape hatch, if you will, to potentially not touch Medicaid if they need to. But even that is somewhat speculative, and we're not leaning too far into that. The Senate's ceiling is higher, but the House's floor, I'm trying not to mix up my my metaphors here. Senate's floor is lower, but their ceiling is higher, and the House's floor is higher, but they don't have a ceiling, is a way to think about it. And again, they instructed the two chambers to reach different numbers, and at some point that number is going to have to agree in order for this to make final passage and then make it over to the president's desk. So there really genuinely is still a lot of work here to do, but we really want to signal very hard to both sides of the Hill that Medicaid cuts should in no way, shape, or form be on the table, regardless of what exactly those final versions wind up being.
Yeah, thank you, Joel. I'm going to turn to a question in the chat from Tina, and this is a question. Do you want stories from health professionals who work with these patients? I worked for years and now have a need for these services, and that she has a story from both sides of the quote bed rails. I have not heard that phrase before. I like that, Tina. I might have to steal that at some point for clinicians with personal experiences as well. Mark, I'm going to hand this over to you. How are the ways in which we are working with our health professional community? And I'll be happy to supplement anything that you don't get to yourself.
Yeah, I mean, Tina, absolutely. And I would message you the link right now, but since I'm controlling the presentation, I don't know what would happen when I go off screen. But I can connect with you offline. We have a story collection form that we're getting stories from any person who is affected who wants to share a story about Medicaid. And what would be nice is we've collected so many stories, which is great, from folks who are on the program, which are so valuable. But getting that alternative perspective of someone who is a healthcare professional just brings a different viewpoint of why Medicaid is important. And our approach is every viewpoint about why Medicaid is important, we want to share, because you never know which one or two is going to resonate with what member of Congress. There are plenty of members of Congress out there who are doctors. Or they might be a previous healthcare professional. Maybe it's a story from a fellow healthcare professional that really says, "Oh yeah, I never thought of it that way." So we are taking stories from every angle possible. So that would be phenomenal to have your point of view. The more points of view, more voices, no matter where you come from, or your professional or your life experiences, to protect the program is so valuable. So Tina, I've written your name in my notes. I'll follow up with you after the call, probably first thing tomorrow, to get you that form you need if you want to share your story. So yes, yes, yes. Thank you for offering.
And Mark, if you're referring to the standard share your story link for our community, I might have saved you an email tomorrow. It's in the chat box, Tina. If you want to click on that, there's a URL there. Feel free to email Tina anyway, though. Maybe you'll have a budding friendship there. All right, so let's move on to the Q&A box. Another good question coming in from Keith here. And actually, I'm just going to return just to Joel what you had to say, because Keith in the chat just asked for clarification pertaining to the resolution differences. He asked, what happened to that 880 billion figure? Did that actually make it into the resolution? Is that still something that Congress is working under?
So they are working under that framework in the House. They are not working under that framework in the Senate. So that's why we're particularly concerned, given that ENC will be marking things up here the next couple of weeks.
Okay, very good. So, Keith, hopefully that answers your question, and that might make you still a little bit puzzled about how to pass a law, they're going to be working under different frameworks. They still have to merge their bills at the end, but at least as of now, they're working under different frameworks. That's what they've chosen to do. So moving on, Keith has another question about lobbying and so forth. And this is, are there really any key offices that we should be focusing on? And Mark or Joel, I think both of you could contribute to if or how we should be focusing on key offices and who they may be. Joel, maybe I'll hand it to you first if you want to reference any decision makers on Capitol Hill that might be playing a particularly important role.
Yeah, so broadly what I'll say, and this is probably stealing Mark's thunder at least a little bit, but any and all offices are important offices at this juncture, but particularly if your member is on Energy and Commerce or on the Senate Finance Committee, they're particularly important. There are several moderate Republicans who have become, let's say, increasingly squeamish about potentially needing to cut Medicaid. So if you're seeing in the news that they are making statements to that effect, that's a nice pressure point to press on. There were 12 Republicans who sent a letter to Energy and Commerce leadership just a couple of weeks ago. If your member was one of those members, that's a good person to press on. But really, genuinely speaking, any and everybody that we can press on, we want to press on at this point.
Yeah, just to back that up with some numbers, and Joel, correct me if I'm wrong, when the House passed their budget resolution that we were nervous about, it passed by 2 votes, correct?
It was very, very narrow, yeah.
2 votes. In a Congress that's this divided, every vote is crucial. So Joel's 100% right. If you want to get to the whole who's making the decisions right now, yeah, folks on the Energy and Commerce are pretty important right now. But that's got to get to the House floor, and they have only 2 votes. It passed by 2 votes last time. So everyone's member of Congress's vote is so important right now. So you didn't steal my thunder, Joel. You were right on thing. I just threw some numbers behind that.
Indeed. All right, I'm going to just go back to the chat just for a second. Rosalba has a good question pertaining to just contacting representatives and senators in areas in which they're likely very supportive of the Medicaid program. We've already covered that to some extent, but she continues on asking about partnering with other organizations such as the American Medical Association, the AMA, and potentially other targets in the administration. I would just say, Rosalba, that absolutely, we've been looking in every way and everywhere that we can to be partnering with organizations. We already mentioned our partnerships with our medical community. In fact, we're working as closely as we can with our over 150 care centers, those areas that, or those clinics that actually provide neuromuscular disease care that are affiliated with the Muscular Dystrophy Association. But we're not stopping there. Within the Partnerships to Protect Care, one of the coalitions that Joel referenced earlier, there are collaborations with provider organizations, and then elsewhere we also have been talking with the American with the AANEM, as well as the AAN, the American Association of Neurology, the American Association of Neuromuscular and Electrodiagnostic Medicine. I think I got the acronym right there. So yes, the medical associations are certainly involved. We're trying to get them involved as well as we can. As for working with the administration, we've heard President Trump in the past say that Medicaid is to be protected. We're hoping that he and his administration are going to fight to protect Medicaid if or when they are to be playing a role on Capitol Hill. Right now, it's very much a Capitol Hill-led process, but nonetheless, whether it be the Secretary Kennedy, which you referenced, or really any of President Trump and his team. President Trump and members of his team have said supportive things on Medicaid historically, and Medicaid historically has also been a bipartisan, even nonpartisan issue for that matter. So we're hopeful that that will win the day, if you will, at the end of this process, that both Republicans and Democrats will come together knowing that Medicaid should not be cut. I'm going to go back to the Q&A because we have a lot of great questions in the Q&A. In fact, I might need to talk a little bit quicker to get up to all of these here. There's kind of two. I'm going to merge kind of two questions here that are similar in nature. One is how we respond to lawmakers, or others for that matter, who say that Medicaid is not being cut. And then another person asks that politicians and others for that matter say that all they're doing is cutting fraud from the Medicaid program. So Joel, maybe I can turn to you first for both of those for that matter and tackle one or both. What would we say to those who are saying, well, Medicaid's not being cut? And then what would we say to those, and maybe they're the same people for that matter, who would say that we're only going to be targeting the fraud, the waste, the abuse within the Medicaid program. We're not actually going to cut eligibility or services from the people on the Medicaid. How would you respond to that?
Yeah, so in terms of Medicaid not being cut, thankfully, the Hill gets to use that excuse for a couple more days and then they're pretty much done because they have to put pen to paper. The reason that they get to use that excuse is because they're just saying energy and commerce, you are responsible for cutting X amount of money. And so in saying so, they get to say, well, we didn't say Medicaid, we said energy and commerce. Like I said at the very beginning of this webinar, energy and commerce's biggest bucket to cut from is Medicaid. So that's really what we tell them is, yes, you haven't said Medicaid, but by all accounts, by referencing energy and commerce, you have said Medicaid. In terms of fraud, waste, and abuse, that's a really, really good point. And one of the way that we tend to answer that is fraud, waste, and abuse is not the fault of patients. The number of patients who are committing some form of fraud, waste, and abuse is infinitesimally small and would make up almost no savings for the program. The people perpetuating fraud are primarily insurance brokers. Occasionally a doc here or there will perpetuate some form of fraud. So that's where this is coming from, but it's not coming from patients. So by going after Medicaid in this way, you're not doing anything for fraud, waste, and abuse. You're just harming the patients that you serve. The other thing around cutting Medicaid is the Congressional Budget Office has very helpfully put out a report that basically says, hey, by saying this number needs to come from energy and commerce, we are putting down in writing in numbers that a vast majority of that money will have to come from Medicaid. So we also have that nonpartisan source to lean on as well, which is very helpful.
Yeah, that's right. Thank you, Joel. Absolutely. All right, so we got some more good questions in the Q&A box here, which I'm going to get to, and then if we have a few extra minutes, we'll come back to those in the chat. So just very briefly, as I think we were able to cover this relatively well, Anna, let's see here. Yes, Anna Marie asked, looking at the website, wondering if we have resources for family members to also be active on behalf of MDA. So Mark, I'll turn to you. Are our resources mostly just for those with neuromuscular conditions, or really is it for the whole community?
Whole community. It's a great question. Thank you, Anna. On our advocacy website, we actually have a lovely toolkit that walks you through the beginnings of grassroots advocacy and the step 1 to step 10 about how you can be an advocate and what things to know and how to message your members of Congress. Everything you could possibly need about being an MDA advocate is on there. And that's great for anyone who has one of our conditions or a family member or someone who just cares about the neuromuscular community. So it's really for everyone. So I really urge you to check it out on our website. So for anyone who wants to advocate, we have tools, we have resources. It's on our advocacy website, and I've written your name down. I'll try to follow up with you tomorrow to make sure you get that. But we do have resources for anyone, no matter if you have one of our conditions or a family member or just someone who cares about the community. We have something for you.
Awesome. Absolutely. And Anna Marie, if there's anything that you think we can better provide to you or to support your family members and friends, or maybe you're a family member and friend yourself, please do reach out at advocacy@mdausa.org. We'll be sure that we get the right resource to you or to your family members and friends for that matter. If hopefully it's already created. If it's not, we'll see what we can do to make sure that we get it to you. All right, so I'm going to focus. There's a couple non-Medicaid related questions in the Q&A. I'm going to come back to those. I just want to see if I can get as much Medicaid covered this evening as we can, knowing that that is really the focus of our time here together. So next question comes from Melinda. There's actually a couple. There's a couple here from Melinda, and some of these have to do with her experience in Louisiana. And the first, Joel, I'm going to turn to you, which is that they have a Katie Beckett law, and which is called the TEFRA Act, I suppose, within Louisiana. Melinda, you are educating me here. I appreciate it. How will this be affected, or could it be discontinued? And I don't imagine you have any firsthand knowledge, Joel, on the TEFRA Act itself. If you do, you will continue to amaze me. But just in general, how will Katie Beckett laws that are across the state, and we can take Louisiana in this case potentially, could be affected by this?
I have the barest knowledge of TEFRA laws because of the federal income tax law. So you're really making me pull back the cobwebs there. But where TEFRA acts kind of intersects with Medicaid is that they create a pathway for Medicaid eligibility for children with disabilities who might otherwise not qualify for the program if their asset limits were too high. And that's honestly probably, and like there are some nitty-gritty things that I'm not going to be able to speak to, but in terms of broadest possible impact, that is probably the greatest impact to the program that we'll see if Medicaid is cut, because again, it's a waiver, right? And those waivers are voluntary, and that's probably where you'll honestly see the first cuts if these things come down the pipe is through voluntary programs like that. So long story short, it will probably impact children who make just a little bit too much money to normally be on the program. They'll probably end up having to migrate off.
Yeah, that's right. It's one of those voluntary waivers, Katie Beckett waivers, as they're called, 1916K, if I remember the statute off the top of my head. And it's one of those voluntary programs that states will likely be able to afford afterwards. So, who knows specifically what happened in Louisiana, but those are the exact kind of programs that we're concerned about potentially going away if these cuts are actually enacted. Keith asks a good question, and this is about what resources do we turn to try to keep up on the latest on Medicaid? So maybe each of us can give one of our favorite sources that we turn to lend to Keith in case he's interested in getting a little wonkier. Keith, you're already very wonky, I'm sure, but maybe we can lend some advice here. Joel, I'm going to start with you. What's one of your favorite places to keep up with the Medicaid conversation?
So there are many, but the Hill, the website, it's spelled the Hill, is kind of my go-to for things like this.
Okay. Mark, do you have one?
Sure. I mean, I was going to say the Hill. It used to be Politico before they kind of put that behind a paywall. But if you're really, I agree with Joel. It really, when we hear when it's been told, like we got a question like, I haven't heard that Medicaid is in the text yet. Why are we concerned about it? Sources like the Hill will tell you why we're concerned about it. When it really goes into the nitty gritty about this budget resolution and what it means for this and that. So I'm with Joel. The Hill is probably where I go for my wonky stuff.
That's right. I'm just going to add two more. Stat News is one of my favorite go-tos. They can oftentimes trend towards biomedical related things, but they still do a lot of health coverage related reporting. The others, if you're really wanting to look into the data and the studies, Joel, you're going to have to help me with the full name, but the Georgetown Center for Children and Families, if I'm remembering it correctly, they publish a lot of research on the importance of Medicaid. And they're a little less newsy. They're a little bit more, if you want to know why Medicaid's so important, go to their research. It's excellent. Joel, did I get that right?
Yep, you did. They also have a really great legal toolkit if you're already in that direction too.
There you go. Maybe some folks are feeling feisty after a conversation here. Just another Medicaid question or two, and I realize we are only 4 minutes to the hour. I do want to get everybody off to their evenings without much delay. But Melinda does ask about wanting to meet with their representative or their senators, especially because their representative or senators may not be holding town halls. They might not be making themselves available. Mark, I'm gonna turn to you because I think we've been navigating this a little bit with a few of our most active advocates. How have we been able to obtain meetings? What advice would you have for Melinda?
My advice, so I see Melinda's from Louisiana, and she talks about Bill Cassidy. First of all, Cassidy is a very popular person to meet with, so it's not too unusual that you might have issues meeting with him, knowing we believe he might be a swing vote coming up. My advice is be professionally persistent as you can. We've at the beginning of the year, we've had volunteers and us too have requested meetings, especially about Medicaid. And it got tough for us to get in some of these offices, but eventually we think the dams is breaking a bit, and we've been seeing more luck of advocates get into some offices. So be patient, be professionally persistent. If you really want to try to meet with staff and having trouble, we recommend maybe calling the district office and seeing if you can get a virtual meeting or an in-person meeting at the district office. We've got some luck with that as well. Especially the last couple of weeks, we've had some great luck getting into district offices. And sometimes if you're able to meet with someone from the district, they might bring in someone they might phone someone in from DC as well, just depending what you would talk about. So my advice is, we recognize it's tough. We've had the same issues, but we're just be professionally persistent and try that district office. You might have some luck there.
Yeah, absolutely, Mark. And Melinda, it looks like you do have a relationship with Senator Cassidy's Stafford office, perhaps, or just with his staff, and whichever it happens to be, that's excellent. That's on your way to developing relationship with the senator himself. So it sounds like you're doing pretty much everything right there. So thank you for your dedication on that. Just scrolling through, I don't know if I see too much else that we haven't been able to cover on Medicaid itself. There's some questions on Medicaid spend down, which is where those who qualify via income would be able to qualify for Medicaid. Trust me, if we were to be working on reforms to the Medicaid program that we want to see, we would be reforming the Medicaid spend down. Unfortunately, that is not the direction that the reform conversation is going in right now. But nonetheless, we hear you on that. Linda points out some great organizations working with us on this, such as FARA, Friedreich Ataxia Research Alliance, and the National Ataxia Foundation, within ataxia and the rare disease groups, Nord and EveryLife as well. Sean, thank you for citing the Kaiser Family Foundation as another good go-to resource. And for those questions, I see at 7:59 there was a great question on NIH and FDA related advocacy. Keith, I'll say if you go to our website, mda.org you know what, tell you what, I'm just going to quickly do this myself. I'm going to link the actions that we're taking and that we're hoping you will take to oppose some of the really concerning things that we're seeing with NIH and FDA that sadly we do not have time to get into this evening. That will be hopefully maybe one of our next advocacy institutes. But in the chat, I just put a link to if you want to voice your concerns with Congress on what's happening at the FDA, at the NIH, at other agencies, please click on that link there. And then Renee, I see your question about appropriations. Sadly, it's 8 o'clock. We don't have a chance to get into appropriations. And I'm not just ducking the question. I love talking appropriations. But if we didn't have a chance to get to your question tonight, feel free to email us at advocacy@mdausa.org. We'll do our very best to answer you there. And with that, I will just thank again everybody for joining us this evening. We are in an absolutely crucial time in our Medicaid program's future. If there was ever a time to be calling Congress about the importance of the program, it is right now. So thank you again for joining us tonight. Thank you for taking action. Thank you for joining us in this advocacy, and everyone have a good rest of your evening. Thanks all.